On January 1st, 2013, my organization, ServiceNet, stopped hiring smokers. We grandfathered people who already worked for us, but starting on that day, we've required all new employees to sign an affidavit stating that they do not smoke and acknowledging the fact that if they do smoke, on or off of work time, even in the privacy of their own homes, that could be grounds for discipline or termination. That day marked the end of a long journey, and as with many paths we decide to take in life, there were some outcomes we could have predicted, some of our predictions that didn't come true, and some entirely unexpected consequences. ServiceNet is a behavioral health and human service organization in Western Massachusetts. Our annual budget's about $55 million, and we have about 1,400 staff. Our services include 5 outpatient behavioral health clinics, a number of residential and support programs for people with serious mental illness, and some addiction services. As a clinical social worker and CEO of this organization for more than 30 years, I had long been aware of the fact that a disproportionate number of our clients smoke. We now know that people with serious mental illness are about 70% more likely to smoke than the general population. And as most of you probably know all too well, our clients with serious mental illnesses are dying between 20 and 25 years younger than the general population. This slide's not good. Oh my goodness. Anyway, what that is a suicidality checklist. And what I want to share with you is the fact that in thinking about the past, we've spent so much more time and energy on strategies for coming up with ways to minimize the risk of suicide in our clients than we have in addressing their tobacco addiction. Whereas the reality is that they are at far greater risk of death by cancer, heart disease, or stroke than they are of death by suicide. I've found it profoundly troubling to witness the death of far too many of our clients far too soon. In some cases, tragically, just as they were beginning to recover and lead more meaningful lives. Even more troubling is a fact that's difficult to admit, and that is the role that we have actually played in contributing to their tobacco addiction. At our local state hospital, cigarettes were routinely used as rewards for good behaviors. And long after the state hospital closed, that tobacco culture continued in our group homes out in the community. Cigarette breaks in our group homes were happy times. Quite possibly for some of the clients, one of the few times when they actually felt on equal footing with their staff, enjoying this pleasurable activity together. Many of our clients came to us as already being heavy smokers, but I'm ashamed to say that some clients that came as non-smokers actually took up the habit after they landed with us. I'd like to share 3 related stories. On a visit to a staff meeting at one of our outreach programs, the staff was talking about a plan they had for taking a trip up to New Hampshire with some clients. I learned that the purpose of the trip was to buy cigarettes because the taxes on cigarettes are lower in New Hampshire than they are in Massachusetts. Later, I questioned the program director as to whether that was a good thing to be doing, and she said that she felt her clients' lives were so limited by their disability and their meager incomes, and smoking was one of the few real pleasures they had in life. I backed off. Second story is about a woman who lived in one of our group homes where all of the people were heavy smokers, and she was hospitalized for 2 months in a psych unit, which by this time had become smoke-free. So she was forced to give up smoking after the agony of withdrawal for the first few days and maybe week. She came back to the group home triumphant, bragging that she was feeling better, breathing more easily. However, 2 weeks later, she was smoking again because it was so much a part of the culture of that group home. On a visit to another one of our programs, a group home for men with serious mental illness, on entering the home, I noticed an oxygen tank in the corner of the living room. And I asked the program director about it, and he told me that one of the clients had developed emphysema after many years of heavy smoking and had to be attached to this oxygen tank pretty much 24/7, except when the staff took him out for a smoking break, which was happening at that moment, hence the unattached oxygen tank. When I questioned the program director, He looked at me, and with a wry smile, he said, "The Human Rights Committee." There were far too many stories like this. We had taken some steps to try to address tobacco addiction in our clients, like smoking cessation groups and tobacco and nicotine replacement therapies. However, I still felt that we were perpetuating a culture of smoking. I felt I had to do something more. So I decided to ban smoking in all of our spaces, all of our properties, indoors and outdoors, and to take the further step of forbidding staff from smoking in view of clients, even off property. This was a step on our journey. This is before we had the idea of not hiring smokers. But even this I thought would be somewhat controversial, so I let staff know ahead of time. And predictably, some of my staff who smoked were upset about it and pushed back on it. But surprisingly, even some of my non-smoking staff were equally upset and passionately. One woman, I'll never forget, looked at me and said, "Please don't take it away. It's all they have." Pretty sad. But we moved ahead with the policy, and on the day before implementation, I sent, oh God, I can't read it. I sent this memo to my staff, which acknowledged their concern. I said, "I am aware that these policies do and will cause inconvenience to many in the ServiceNet community. Just remember that smoking can cause more than just inconvenience. As you know, it can cost you your very life." The policy went into effect on April 1st, 2009. No connection with April Fool's Day. It's just that with New England weather, we thought spring was a better time to get people eased into this new policy, which was going to require that they be outside a little bit more to get off property to smoke. Implementation was kind of uneventful. Like many changes in organizations, the anticipation is sometimes worse than the reality. However, things were not completely copacetic. I started hearing reports of pockets where the new policy was not being followed, where enforcement was kind of spotty. In one case, one of our group homes, the smoking literally went underground. One of my maintenance guys reported to me seeing a pile of cigarette butts in the basement of the group home. On poking around more and learning what was going on, I noticed that there seemed to be a correlation between staff who smoked, and difficulty enforcing the policy. I'm not saying anyone was deliberately doing a, "See, I told you it wouldn't work" number on me, but the thought did cross my mind. Sometime around this time, I learned that the Cleveland Clinic had stopped hiring smokers, actually back a couple years prior in 2007. In reading further, I learned that several organizations around the country, many actually, had adopted policies like that, some in the healthcare field, but even other companies giving reasons such as wanting to reduce absenteeism in their staff or reduce health insurance costs. Further research told me that there had been several legal challenges to these policies, but none had been won because cigarette smoking or smokers are not a protected class, so it would probably never be illegal. So I was thinking, since there's a correlation between people's ability to enforce this rule, the no smoking rule in our agency, and being smokers, I thought if we could reduce the number of smokers in our organization, it would be a good thing. So I proposed the idea that we adopt a policy of not hiring smokers to my senior management team, and they pushed back. They were dismissive. They thought I was not wise in suggesting this. They cited all kinds of reasons, like it would be a civil rights violation, even if the ACLU would come after us. It would be embarrassing. We'd be all over the newspapers and so on. So I let the idea go. Our HR director actually checked with our labor attorney, and she also advised against it. And by the way, she was a heavy smoker, the attorney. So fast forward a couple of years, and I'm in a meeting with Peter Straley, who was the then CEO of Health New England, which is a large health insurance company in our region, and they were and still are the providers of health insurance for our employees. And Peter suggested that we consider adopting a policy of no longer hiring smokers. He told us that he was suggesting that to all of his employers, especially the ones in the healthcare field. And he further told us that Health New England had also adopted that policy. They were no longer hiring smokers, and they'd implemented it a while before, and they felt it had gone very well. So what happened next is a good example of the adage, you can't be a prophet in your own land. So I had a couple of senior management people with me at that meeting with Peter, and all of a sudden they were open to the idea of considering this kind of a policy. So I went back to the rest of my senior team and presented the idea to the rest, being careful to frame it as Peter's idea, not Sue's. So they were open, and we discussed it. They were still skeptics, and we still didn't reach consensus that we should move forward. However, we reached consensus on exploring the idea. So for the next several months, I and other senior managers, in our normal rounds around the organization, we discussed this idea, this proposal actually, with staff. And we also held some special sessions for the explicit purpose of discussing this idea. And we heard arguments against it, the same ones we'd already thought of, and also some we hadn't thought of. For example, one staff pointed out that even non-smoking job applicants might be really put off by the idea that an organization would message into people's personal lives, which was none of their business. We also heard, somebody also suggested that this policy would be classist and racist because people from lower income groups and minorities are more likely to smoke. However, many staff were strongly supportive of the idea. One staff wrote to me in an email, "I'd be so proud to work for an organization that would take such a bold stand against tobacco." So we decided to go ahead and implement the policy after several months, actually, almost a year. So we implemented the policy, but in a few months prior, I decided to warn people that it was a definite decision, and I did a Q&A at the end of the memo, and to prepare people. And one woman, a manager, actually the director of one of my outpatient clinics, wrote me an impassioned plea to reconsider and think twice about doing this because it was disrespectful of people. And I wrote back to her, and I said, for me, this decision really comes down to a question or a decision between human rights and human lives. And for better or worse, in this instance anyway, I'm choosing the latter. So we went ahead and we implemented the policy. And on January 1st, we put that new policy in all our job ads, and it went into effect. Strangely, 2 months or so went by and I heard nothing about any further pushback or results, bad results or anything. So I asked my HR director if they were noticing anything in the HR department, and she said no. She was surprised as well. However, something strange happened. I started to notice around this time that our new employees were seeming more brighter and more engaged. And I, at first, didn't make the connection. But I mentioned this observation to my HR director, and she said she had noticed that as well. And she didn't think about any connection. We talked about it together, and we wondered out loud if it was some change in the local economy that we hadn't noticed or something was going on. Suddenly, we looked at each other and realized, we said, it's the policy. And this trend has kind of continued it's been 3 years now. We have noticed that our employees do seem more engaged. No scientific study, but a few months later, we got an email sent to the general mailbox at ServiceNet from an employee, a job applicant who had applied for a job at ServiceNet, and she'd actually withdrawn her application because she'd gotten a promotion at her current job. But she was writing to us because she wanted to let us know that our policy had been the impetus for her to stop smoking. She said she'd tried many times unsuccessfully, and she really wanted to work for our agency, so she gave up smoking, and she wanted us to know it. And you can't read this, but I want to read you some excerpts from her email to us. I know there's a lot of controversy surrounding whether or not employers can govern what people do on their off time, so I wanted to throw in my 2 cents and let you know it worked for me. I say, stick to your guns. Your policy, I can't read it all, but has improved the quality of my life for my loved ones who would possibly have had to help take care of me in the future. I am also now being a better role model for my duly diagnosed clients who smoke, and who knows all the good that has come from your policy beyond just little old me. So I wrote back to her and thanked her for the feedback, and last March she wrote to me again to let me know she'd passed the 2-year mark and she was still smoke-free. Recently, when I was thinking about this talk, I emailed her to tell her I was thinking about sharing her story here, and she said she was honored. I also asked her if she would send me a picture, and she sent me this picture, and she said she wanted to send me a picture that included her son because our policy had influenced his life as well. So, where are we? I need to tell you all that some states have since passed laws that prohibit discrimination against smokers in hiring practices. So if you're thinking of doing this, you need to check on your state. However, it's legal everywhere to outlaw smoking outdoors, indoors, anywhere on your property. And it's also legal to prohibit staff from smoking on work time, even on breaks, if you're paying for the breaks. So what has been the impact on ServiceNet? We've had no difficulty recruiting people. If anything, the quality of our new recruits is higher. We're still getting as many job applicants from minority groups as before. We've had no lawsuits, no picket lines, no attacks. In short, no bad impact at all. So lessons learned. And by the way, it's no scientific data, but we're thinking that maybe we're making a bit more progress in helping our clients, supporting our clients in stopping smoking, just because of having this culture of not smoking and not hiring smokers. So lessons learned. When I think back over the past, I realize that we were enabling this bad behavior. We were supporting people in habits that were actually killing them because we were afraid to take a risk of a lawsuit or somebody attacking us. So it makes one wonder. And once we decided to take bold action, we've changed lives in ways we couldn't have even predicted, even outside of ServiceNet's doors. So it makes one think, what other policies or assumptions do we hold in our work that really we should re-examine? Thank you.